My name is Michael Bahk. I'm an orthopedic physician. I practice in the Los Angeles area. I went to college and med school at Northwestern, and then a lot of training afterwards as part of my subspecialty. I did a 5-year orthopedic residency at Johns Hopkins in Baltimore, and then at that point you can practice orthopedic surgery. I had a desire to really understand arthroscopy and shoulder surgery. So I did a second sports medicine fellowship in California at the Southern California Orthopedic Institute, and trained with some of the pioneers in arthroscopy, um, as well as did a second fellowship in shoulder and elbow surgery at the Rothman Institute in Philadelphia. And then was fortunate enough to come back and practice at Southern California Orthopedic Institute, or SCOE. We like to call it SCOE for short. And I've been there for about 10 plus years. Yeah, I actually decided I wanted to go into medicine in high school. And that's kind of an early age. My personality type is I really like to learn. I like to do things, and medicine is an amazing field because there's constant learning and constant technology and constant breakthroughs and discoveries, and that learning aspect always excited me. For whatever reason, I just enjoy always learning about new stuff. So and thinking about tomorrow, and so that was a field that always intrigued me. Um, I really thought the human body was an amazing machine, and orthopedics really allows you to work with that musculoskeletal machinery. I like to work with my hands, and that's why I thought a more hand-based field like a surgical field would be interesting. Orthopedics, the subject matter was interesting. Medicine was interesting, and at the end of the day, you get to help people, which I thought was great. Um, we, I think the thing I liked about orthopedics is that you helped people get back to an active lifestyle, or the active life, or a lifestyle that they enjoy. And so helping people to do what they want to do is something that appealed to me. So of the fields out there, I like medicine for those reasons. And then within medicine, there's orthopedics kind of appealed to me for a number of reasons. But so orthopedics within medicine, they branch out, and orthopedics is bone and joint medicine. Um, and actually, I believe the Latin phrase orthopedics means to make straight. So one of the symbols that orthopedics use is a tree, kind of tied to or roped around a pole or stick, meaning that we do things in order to help the tree grow straight, or the tree grow properly, or the body to grow properly. And that means that anything with joints, bones, muscles, tendons, we tend to work on. So you break a bone, you see the orthopedist. You need a joint replacement, you see the orthopedist. If you have a spine issue, a herniated disc, or a scoliosis or a crooked spine, you see an orthopedist. So anything with the actual musculoskeletal stuff is in the purview of the orthopedist. Yeah, it's kind of a combination of clinic and surgery. So we see patients in the clinic. If you have, let's say, a knee problem or a shoulder problem, you make an appointment. You see the orthopedist in the clinic, and the orthopedic surgeon there will evaluate you, maybe get X-rays, order tests, do a physical exam, talk to you, get to a diagnosis, and then a treatment plan, whether that's therapy, injections, or surgery. So about half the time I'm in the clinic, and about half the time I'm in surgery. And so, for example, if somebody needs a shoulder replacement, or a knee arthroscopy, we would see that patient at the operating room. do the surgery or perform the surgery, and then follow them in the postoperative care within the clinic. So it's a combination of going to the operating room and physically performing the surgery, as well as seeing the patient in clinic. Um, I think the things that intrigued me to go into orthopedics is still holds true 10 plus years later as to what I like about it. Um, it's a field that's rooted in anatomy. So if you know your anatomy, you understand what's happening. Um, it has a lot of technology. We use a lot of technical instruments, technical equipment to perform the surgery that we need to do. So, for example, and so I always like that technological evolution and process and finding new technologies to incorporate to help people. And so, for example, what's interesting and very helpful nowadays is robot assisted technology. So the surgeon performs the surgery. Um, and because the surgeon's a human being, there's a margin of error. You might make a saw cut on a bone, for example, um, and maybe you're off that day and it comes off a little less than ideal. But if you have a robot, the robot can help you perform that surgery perfectly. And so I very much enjoy the technical aspect and the challenge of physically performing the surgery well. And that again appeals to my personality and a desire to work with my hands and do things well. But the robot makes it a better surgery for the patient and for the doctor. So um, I like that constant technological or technology involvement, the learning, the achievement, and the end again helping people. So those combination of things are what I enjoy and what keeps me interested in the field. Yeah, so I think maybe going along with that, the challenges are that you have to keep abreast of the technology changes. We're always constantly learning, and something better, if it comes around, you want to incorporate that. So that takes time. That takes conferences. Um, my particular job is working with fellows. So we work with a number of trainees every year. We have a sports medicine fellowship. Well, we're also academically inclined and we publish and do research, which I enjoy. And we're also a UCLA affiliate. So we have this, it's a private practice group with academic ties. And the challenge is doing those other things, which is takes time, but it's positive in that you can incorporate those things. So I guess the biggest challenge is keeping abreast of all the medical knowledge that's constantly changing and incorporating that. I think practically speaking on a day-to-day basis is the non-medical practice side of things, is the work dealing with insurance companies, um, getting things authorized, and that type of thing. I'm probably least the most least enjoyable part of the field. Since we have fellows, they're always in in the know, in the now. So having a new batch every year helps us stay in the now, which I think is a very good thing. So I think the robot assisted surgery is probably the most interesting nowadays. Other aspects are virtual reality, where you can wear goggles or lenses within the surgical field, or like a pop-up screen that allows you to understand things better. Um, um, I think that's very interesting, and I think that will help change the field. And a lot of that technology is more used for joint replacement surgery. So, when we do, for example, a shoulder replacement, um, I can see the anatomy, but I can't see everything. because we don't get a 360-degree view. We only see what's in the surgical field. And that's when your surgical knowledge of anatomy and maybe some preoperative CT scans or MRIs helps you understand the anatomy better. But those technologies can make that even better in terms of screw placement or bone cuts or whatnot. Um, so I think those are the more exciting things for nowadays. Yeah, that's a great question. I think that medicine's a great field. It's a great field, uh, but it's not for everyone. Um, and so, if you have a passion for that field and you really enjoy that field, then it doesn't become a labor. It becomes an act of enjoyment, a passion. And so I think that the key is to make sure that you like that field, whatever it is. And it doesn't apply to just medicine. It could be um, field A, B, or C. So, and everybody's built differently. So I think that you have to find what makes you tick and understand that. Um, and then if you match that field, that's the best decision you can make because, no field is perfect. There are thorns and thistles in every field, but those non-fun parts of the field become less an issue when the rest of the field is so great. And so there's an interesting book that someone gave to me once called Strength Finders 2.0 or 2 point something nowadays, or it's probably advanced, but that's a field that doesn't, that's a book that you read, you take a test, and it tells you how you're made, and what really your personality appreciates or how you're built. Um, and so for me, it gave me qualities that I'm futuristic. I like to achieve. I like to learn. Um, and it's not really a personality test. It's more about what your strengths are. So then that can help you decide uh, how you're built and what you want to do. And everybody's built differently. I think that if you find something that you wake up every day eager to do, that's the best decision you can make. And so then your life becomes an act of interest instead of just going to work just to go to work, so to speak. A person should expose themselves to as many fields as they can and people and types of work, and then really try them on and see if that's what you want to do. Um, I I think the earlier the better. I think the more exposure they have to multiple fields, the better. So, and who knows? Maybe I would have liked to do something else if I had been exposed to something else. That's possible. I really enjoy what I do, so I don't know. But I think that the more a student can do, it only helps them.